Stand by SOT1.
Standing.
10 seconds. Ready, rollin'. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It is January 24th, 2022, 12 noon straight up. Welcome to another edition of Work Comp Matters. We are, of course, part of mymancavepodcasting.com network. We have over 600 podcasts in the tank. They're completely free, no obligation, available to you 24/7, anywhere you are in the world. All you need is a smartphone or a computer. And if you want to take a step forward and do your own podcast, we will manage, produce, direct, stream that puppy live, and get it into the cloud forever. Good afternoon, everybody. My name is Steve Appel. It's a pleasure to be here with you, with Mr. John Scalia in Munich, Germany. Stories in the news today that we believe are of interest to you employees, employers, and of course, we haven't forgotten about you damn independent contractors in California. Vaccine wars ignite in California as lawmakers seek stronger laws. Bills would close loophole, force kindergarten through 12 students to get a COVID shot. No more cloth masks allowed in Los Angeles schools. From the San Francisco Chronicle, COVID cases may have peaked, but hospitals still face a torrent of patients. Los Angeles County, third straight drop in COVID hospitalizations. From behind the orange curtain in Orange County, number of patients hospitalized with COVID is shifting. In the South Bay, busy hospitals deal with more widespread but less severe COVID infections. And down south in San Diego, weary but still showing up, frontline medical workers pray for patients. We have these stories, maybe more, maybe less, on today's edition of Work Comp Matters. I'm going to get to the first story dealing with loopholes. Loopholes force K through 12 students to get COVID shots. State Senator Richard Pan, Democrat Sacramento, will announce, or already did announce this morning, a bill to add COVID-19 vaccines to California's list of required inoculations for attending K through 12 schools, a move that would close a loophole and override Governor Gavin Newsom, who, of course, I affectionately refer to as the Gav, Governor Newsom's scaled back mandate from last year. And before we go to John and his story, there's been talk that the Omicron is raging. Technically, it's more, scientifically, it is more contagious than the Delta or the original. But now, of course, we have 60%, 70% of the people vaccinated. The only people that are in the hospital and are dying, over 95%, are not vaccinated. There has been talk of a potential shutdown again, and I don't see this happening. We have 60 to 70% vaccinated. Certainly, our community would be better off. Our businesses would be better off. Our hospitals would be better off. Our way of life would be better off if everybody were vaccinated, but that just is not a realistic possibility. But I see as a, pardon the pun, a political death if parts of the United States were to be shut down again. I know that in the UK, and John, correct me if I'm wrong, but didn't the UK just last week announce all mandates are lifted?
I think they did. Yeah, they're pretty much going open. Of course, Boris Johnson is in real hot water over violations of COVID during the lockdown. So he's scrambling now for anything that will distract the populace from what he's accused of doing. But yeah, they pretty much have opened up. I think they were going to do it anyway.
Yeah, this would be a better society all the way around if everybody were vaccinated, but you're not going to get 100% vaccination level. I think right now, this thing keeps going on and on and on. We're almost 2 years in. The official declaration in the United States that this was a countrywide national health epidemic, as I've said before, was March 13th, Friday the 13th of 2020. We are less than 2 months away from that. And so, I want to see everybody, vaccinated, but, can't force people to jab themselves.
Well, actually, you can.
Well, it's never happened before.
Well, I mean, by and large, it's politically unacceptable. You certainly, as they point out, there's vaccine mandates for kids regarding measles, mumps, all kinds of things. I mean, vaccine mandates are not unheard of. Now, whether the government can simply, have an executive order or whatever, but certainly through the legislative process, I would say that if the legislature did it, I think it would be upheld. I don't think there's any question that legally that would be okay.
John, I'll tell you, it's never happened before. And I don't think either the state Supreme Court or the United States Supreme Court is going to approve a mandate or a law that people inject themselves with drugs. Now, clearly, if you want to prevent people from going in public, if you want to prevent people from going to work, if you want to prevent people from doing lots of things, unless they've got that vax passport, that, it is on arguably solid ground. But never before have we had a law that forces people to inject themselves. Go ahead.
Well, obviously, they wouldn't be injecting themselves, but
yeah. You know what I mean, John.
I mean, you're making it sound as if you're telling them to do heroin, but
okay. Well, you know what, I gave my opinion. John, for lack of better words, gave his opinion. It's time for the next story that John and I believe are of interest to you California employees, employers, and independent contractors. John.
Okay, this one is from Cal Healthline itself. Vaccine wars ignite in California as lawmakers seek stronger laws. California is poised to become the front line of America's vaccination wars. State lawmakers are drafting the toughest COVID-19 vaccine legislation in the country, backed by a new pro-vaccine lobbying force, promising to counter anti-vaccine activists who have threatened government officials and shut down public meetings across the state. Legislators want to require most Californians to get the shots, not just school children and healthcare workers, and eliminate the exemptions that would allow many people to get out of them. But vaccine opponents say Democratic-led efforts to adopt stricter vaccine requirements are only helping propel their movement, handing them unparalleled momentum to build their ranks both in California and nationally. Vaccine opponents are focusing their ire on Democratic State Senator Richard Pan of Sacramento, a pediatrician and the driving force behind 3 state vaccination laws passed since 2012. Prompted by outbreaks of pertussis and measles, the laws make it harder for school children to get out of childhood vaccinations. We have to be willing to take a stand, said Pan, who is developing legislation to crack down on COVID vaccine exemptions. We need to be able to respond to this pandemic and future pandemics, but there is this asymmetrical warfare going on right now, and we're seeing the anti-vaccine movement, trafficking and misinformation, threats and violence. Now, just as an editorial aside, you know that I'm big on the comorbidities that go along with all the, deaths and horror stories of COVID. I'm all for treating people who get it, but let's face it, when you have a comorbidity or when you refuse to get vaccinated, then you're putting yourself obviously at greater risk. And guess what? Sometimes the risk is actualized. The woman in the picture on this article is holding a poster that says, "Hey, Newsom, leave our kids alone." And in back of her is a sign that says, "Dr. Fauci, stop all the lies." Now, I just want to tell you, apparently this woman has young kids. You know what? She's already obese, and she's not morbidly obese yet, but she's obviously going there. Most of her face has disappeared. You know what, lady? I'll tell you something. Kids grow up to emulate their parents. They don't care what you tell them. They don't care what you say to them about vaccine this or vaccine that. They look at what you do. And if you are morbidly obese and eating yourself into a chair, guess what your kids are going to do? And that's a comorbidity that's going to come back and haunt you. If not during COVID, it's going to haunt you later on in life for heart disease and a variety of other ailments.
Hey, teacher, leave those kids alone. All in all, it's just another brick in the wall. Yep, that's why I don't sing on the podcast. From San Francisco.
For violating copyright on that one?
Yeah, exactly right. This winter's Omicron surge, the most explosive wave yet of the 2-year-old coronavirus pandemic, may be cresting in the Bay Area, but hospitals expect more challenging weeks ahead as the astonishingly high case counts continue to translate into a torrent of patients. Though the highly infectious Omicron variant is causing less severe illness than earlier strains of the coronavirus, this winter has in some ways been just as difficult for hospitals, healthcare staff, and administrators say. They may have fewer very sick patients, but most hospitals are about as busy this year as last as they deal with staffing shortages caused by COVID on top of profound physical and emotional fatigue among workers. And yeah, I get that. Science indicates that the Omicron side effects are less than Delta, but also as the Omicron sweeps across the country and the world, more people are vaccinated than were prior to Omicron existed. So if you combine the side effects with Omicron, in addition to the higher percentage of the population being vaccinated, the potential side effects are going to be considerably down. This is why over 95% of the people that are in hospitals, in ICUs, and have died have been the unvaccinated. John.
Yeah, remember what I said at the very beginning of the Omicron thing when they were saying, well, it's more infectious, but it's less serious. What did I say? I said, well, if twice as many people get it and only half as many people are as serious, you're back to the same numbers. And so, it may not be the same. Obviously, in terms of hospitalization, it's the same numbers. And in terms of death, fortunately, it's less. But again, when you double the population, half that population is the same as before, when it was more serious. This is from, where is this from? This is from the Chronicle again. COVID-related hospitalizations are rising in SF. Data from UCSF sheds light on how many are for COVID or with COVID. COVID-19 related hospitalizations in San Francisco have reached an all-time high. How about that? On Tuesday, the city reported 262 COVID positive patients, 3 more than the maximum reached during last winter's surge. I guess I know my stats, huh? Since then, hospitalizations have continued to rise. By Thursday, there were 274 COVID-related hospitalizations in the city, according to data from the California Department of Public Health. Along with this surge, an important distinction has become key to understanding COVID-related hospitalizations. Are patients being admitted for COVID or with COVID? According to data from UCSF, as of last Wednesday, about 60% of COVID-positive patients across its hospitals were admitted primarily for the virus. The remaining roughly 40% were so-called with COVID hospitalizations, patients admitted for non-COVID ailments, but incidentally tested positive for the virus. While UCSF's for COVID hospitalizations are closing in on their peak, they remain below what they were last winter. On the other hand, incidental cases are at an all-time high. Before Omicron, fewer than 15 daily hospitalizations were categorized as incidental. But so far this month, the health system has averaged almost 40 daily incidental hospitalizations and recorded the highest yet of 51 last Wednesday. So there you go.
From behind the orange. Oh, well, you know what? Let's pay a bill first. You're dialed into Work Comp Matters. We are part of the mancavepodcasting.com network. We've got over 600 podcasts in the cloud forever. They're available to you 24/7. And all you need is a computer or smartphone anywhere in the world. If you want to do your own podcast, we will produce, direct, manage, get that sucker stream live and into the cloud forever. Now, back to the news that we believe interests you, California employees, employers, and independent contractors. Going behind the orange curtain from the Orange County Register, number of patients hospitalized with COVID versus for COVID is shifting. While hospitals are still under strain from an influx of patients and staff shortages due to quick spreading Omicron variant, they're now seeing a marked increase in patients who have COVID-19, but were admitted for some other medical issue. That's a change from earlier waves of the pandemic, when a majority of people entering hospitals with COVID-19 had trouble breathing or low blood oxygen levels and also needed respiratory support. You know, John, what the story doesn't say, it says that people are admitted into the hospital for any reason besides COVID. Then when they're tested for COVID, they got it. It doesn't say whether they contracted the hospital before going into the hospital or whether they contracted COVID in the hospital. John.
Okay, we're going to go even further south than the orange curtain. We're going to go to San Diego from the San Diego Union Tribune. Weary but still showing up, frontline medical workers pray for patients. Once again, San Diego's county healthcare workforce is being tested by a surge in coronavirus cases. But this new wave brings a cruel twist. Though the Omicron coronavirus variant causes less severe symptoms, at least among those who are fully vaccinated, there's that again, it's much more infectious than last year's versions. Droves of healthcare workers have tested positive, calling in sick and leaving whoever remains, having to work that much harder to hold things together. The staffing situation reached a terrible peak last week, with 2 South Bay hospitals declaring internal disasters. Those declarations impacted both medical centers' abilities to receive ambulance deliveries, even those carrying patients with deadly conditions like strokes. The situation illustrated just how fragile the region's treatment capacity can become when there are too many patients needing care all at once and too few specialists to take care of them. It appears that the staffing shortage is starting to ease, as many who tested positive a week or two ago are starting to return to work. But the number of new coronavirus cases appearing daily continues to run high, bucking the declining national trend, strongly suggesting that hospitals are likely to see large numbers of COVID-19 patients arriving in their emergency rooms for weeks to come. What have I always said? And I got to say it again, probably in another article. But when you have a healthcare system that basically is run like a private business, because remember, nonprofit designation is simply a tax category. The nonprofit hospitals are run the same way for-profit hospitals are run, and they're run like businesses. And what do businesses do these days when we've gotten so used to having FedEx and supply lines that are instantaneous? Well, we know they run right, just right to what they need and no more. There's no excess to worry about, because you're not going to waste the money. Well, the problem when you run a healthcare system like that is, well, everything's fine in normal times, but these aren't normal times. And what's happening is, there's nothing left over for people to take care of. Plus, businesses run people, as we all know. Basically, businesses, especially in capitalist countries, run people into the ground. I mean, that's basically a capitalist mantra: work until you drop dead at your desk. Okay. And what's happening is the people are literally dropping out. I mean, and in fact, it's happening not only because of this, but all over the economy now. It's even got a designated term by economists. It's called the Great Resignation. So there you have it.
Yes, from the Sacramento Bee, California sends out pandemic bonus checks for in-home caregivers. California Department of Social Services has begun mailing $500 bonus checks to more than 500,000 caregivers in the state. Eligible in-home supportive services providers began receiving their payments January 20th, said department spokesman Jason Montiel in an email. Quote, "It will take about a week to distribute them all," close quote. Why do I think it's going to take longer? John.
Probably based on your experience, Steve.
Yeah. The check's in the mail, and well, I won't do part two. But go ahead.
You won't do part two. Not today. You won't.
Yeah, right.
Okay. This one is from the Bay Area News Group, from the East Bay Times, actually, in the San Francisco Bay Area. How one person's cells led to our only antibody treatment for Omicron. Years ago, a survivor of a previous deadly pandemic gave a gift that is helping save desperately ill COVID-19 patients today. The donation, a blood sample holding infection-fighting cells from the deadly 2003 SARS outbreak, is the basis of a new Bay Area designated therapy that is now the sole monoclonal antibody that can fend off the Omicron variant, preventing serious illness or death, as traditional treatments fail. Currently, it's the only monoclonal therapy that works, said Dr. Warner Green, director of Gladstone Institute of Virology and Immunology at UCSF, called Sotrovimab, try to pronounce that when you first see it. The treatment is so precious that hospitals are running out. As COVID-19 cases soar, the federal government has contracted for 600,000 doses from San Francisco-based company VIR Biotechnology, boosting the young company's estimated 2022 revenues to a stunning $2 billion, according to Cohen Equity Research. It's a great achievement. Yeah, I think it is $2 billion worth. It's an important tool for patients at high risk of getting worse or being hospitalized, said infectious disease specialist Dr. Daniel Shin of El Camino Hospital in Mountain View. Demand is outpacing the supply. Now, I think it's great that people get rewarded for doing really, really good research, and they should be rewarded, and that includes financial rewards. But let me ask you this: the guy who gave that blood, which is what this whole thing is based on, he gave it. So the people who are making all this money are making it from a free donation, and they're making it at public expense. So the question is $2 billion, a reasonable thing to do when the research is only made possible by the generosity of somebody who willingly, freely gave the blood donation that made all this thing possible? I think it might be a bit excessive. Steve.
From the New York Times, Fauci cautiously says U.S. wave seems like it's going in the right direction. Dr. Anthony S. Fauci sounded cautiously optimistic yesterday that the Omicron wave was peaking nationally in the United States and that the coronavirus cases could fall to manageable levels in the coming months, whatever the heck that means. What we would hope, according to Dr. Fauci, who is the president's top medical advisor for COVID-19, said during an appearance on ABC this week, is that as we get into the next weeks to month or so, we'll see throughout the entire country the level of infection get to below what I call that area of control. John, I don't know exactly what that means, but I don't think anybody ever announced it's been the area of control since it started 20 months ago. I don't know what that means.
Well, I like Dr. Fauci, but I have to admit, he's a career bureaucrat, and he generally speaks bureaucratese. So it's like trying to get a diplomat to say something one way or the other. I mean, by and large, he won't. The only time he came out of that bureaucratic shell was he got so frustrated during a Senate hearing on Rand Paul, who's an ophthalmologist, and he said he's a moron.
Well, actually, it wasn't Rand Paul who's an ophthalmologist. Rand Paul quoting an ophthalmologist, right? Or am I
I'll
wrong?
check. I think Rand Paul is an ophthalmologist, but I'll check. Oh, he's a doctor. He's a medical doctor.
I didn't know that. But John, I agree with you. I have always respected Anthony Fauci. He's been specializing in infectious disease for 30 years. He's been on the president's advisory committee for however. But yes, for lack of better words, when he is interviewed, he does sound like a bureaucratic politician, but that does not in any way, shape, or form, for me, discount the respect and the knowledge that I have for him. But yeah, sometimes it is hard to get a straight answer out of him. Go ahead.
His credentials are unquestionable. I mean, he was also one of the people instrumental in getting the treatment for HIV. I mean, he's a card-carrying Catholic. So obviously his science, his science is independent from any of his individual beliefs. The last article I have is one that is really close to my heart, and I'm sure it's close to Steve's too, because we've both represented injured workers. And we both know that probably the most difficult injured workers cases you can have are the ones that are caused by chemical exposure. Because why? Because basically in America, chemicals are not regulated, and your ability to find out what chemicals are being used is like trying to pierce the CIA. You agree with that, Steve?
Well, I agree with everything you said, except that chemicals are not regulated. That's totally untrue.
Oh, no, it's true. We can talk about that later. I mean, it's definitely true. But anyway, in fact,
Okay.
Yeah. This is from the SAC-B. 5 workers sue Sutter Health for cleanser corrosive to eyes, skin, respiratory tract. Now, if I can just pull it up, I got the head. Oh, here we go. Okay. Sutter Health faced high rates of infection in its hospitals from a germ that causes severe diarrhea. And to combat the problem, the company procured a cleanser so noxious that dozens of employees have reported illnesses after using it, according to a lawsuit filed in Alameda Court earlier this week. The new product, now I don't know why it's filed in Superior Court as opposed to work comp, but anyway, the new product, Ecolab's Oxycide, was cheaper than the 2-step cleaning process that workers had previously used, saving Sacramento-based Sutter millions of dollars. Attorneys alleged in a suit that seeks class action status to represent 1,800 environmental service workers. Rather than eliminate the product when confronted with its effects, Sutter wrote off the harm as user error and put the workers through retraining, doubling down on knowingly false claims to all environmental BS service workers that the product was essentially harmless, according to the lawsuit. Following the B's request for comment, Sutter Health released a statement saying that the health and safety of employees is the company's highest priority. You're right. And that Sutter leaders are proud of their efforts being taken by affiliates to reduce hospital-acquired infections, including those caused by Clostridioides difficile or the C. diff bacterium, whatever those are. Anyway, there you have it. So there's a hospital using a noxious substance, and it's saving them millions. So rather than saying, yeah, it's really noxious, we made a mistake, we'll go back to the old 2-step, they don't want to do it because it saves millions of dollars.
All right. And that'll about do it for this edition of Work Comp Matters. I want to thank John, closing thoughts, burning desires.
No, not really. I think we've said a lot anyway.
Yeah. Thank you very much for joining this edition of Work Comp Matters. Much thanks to Scott Walton of Legendary Uncle Studio, John Scalia in Munich, Germany, all the good people back at mancavepodcasting.com. John and I will be back on Work Comp Matters this Friday, 12 noon live, for another edition of Work Comp Matters. See you then.